ArthraCare introduces Topaz, a new alternative for treating the tendon and fascia. Tendons and fascia are frequently affected by repetitive motion activities, resulting over time in hypovascularity and collagen degeneration. Treatment should be specifically designed for these kinds of abnormalities. Topaz is the quick, simple, minimally invasive answer. It uses the same patented coblation technology that has been used in over 2 million surgical procedures in a unique way. Topaz appears to improve vascularity and to promote vascular endothelial growth factor production, angiogenesis, and enhanced collagen production. Surgery with Topaz requires an ArthraCare controller with foot or hand switch control, an ArthraCare patient cable, an ArthraCare timer, saline or Ringer's lactate solution, and sterile IV tubing. This program will illustrate surgery involving the fascia. To begin, identify and mark the symptomatic area while the patient is still alert. Place the patient in the appropriate position. Administer general or local anesthesia as indicated. Utilize a tourniquet and elevate the treatment area to the appropriate level. Create a small incision, medial, approximately 1 inch, over the area of maximal tenderness, commonly over the medial slip of the fascia. Incise when appropriate to expose the involved fascia. After the device is connected to the sterile line providing saline or Ringer's lactate, flush the line to remove all air bubbles. Adjust the power setting on the controller to set point 4. Adjust the saline flow to 2 or 3 drips per second. Place the tip of the device on the surface of the fascia perpendicular to the structure. Activate for 1/2 second with light pressure at 3 to 5 millimeter distance intervals on and around the fascia. Alternate perforations from superficial to 3 millimeter to 5 millimeter depth, creating a 3-dimensional grid-like pattern. It's important to activate the device briefly at the recommended 1/2 second intervals. The ArthraCare timer provides a predetermined 1/2 second interval. Once the area is treated, irrigate with normal saline. Close with appropriate wound closures. Finally, administer a local anesthetic and standard sterile dressings. Post-operative care for the first 3 weeks should include immobilization with the use of crutches. During week 4 to week 8, passive and active range of motion exercises can be initiated. Use a night splint and provide a cam walker as appropriate. For 2 to 3 months, avoid sports and heavy lifting. Normal routine at work or at home is okay at the discretion of the surgeon. With appropriate post-op care, patients can look forward to rapid recovery and return to activity thanks to this new, minimally invasive approach to treatment.